Can I please get a brief overview of your current interests?
Yeah, I mean, I have lots of interest from a clinical standpoint. As a nephrologist, pretty much anything kidney is right up my alley, but I am a hypertension expert. That was one of the things that I saw quite a bit in my clinical practice. Glomerulonephritis expert, kidney stones. We all, from time to time, will have a patient with kidney stones, and they often don't get treated the appropriate way. They're typically treated surgically immediately, and then no one really stops to figure out why they form stones and keep forming stones. And so those are kind of some basic beginning interests that I have.
All right. So can you tell me a little bit about why you feel case-based research is important to the medical field?
Specifically, like for the talk I'm going to be doing, or?
Yes.
Yeah. Well, you know what medicine is, pattern recognition for the most part. And I don't like to say that too much because we do need to stop and think and come up with a differential diagnosis. But the vast majority of medicine is pattern recognition. And so by approaching, for instance, the topic of glomerulonephritis from a case-based standpoint, you can see the various little nuances that might point you in one direction or another. And that's, to be honest, how medical students, when they go to take their boards, whether it's licensing boards or for their actual specialty, that's how they're going to have to recognize things.
Do you think there will be useful applications for this approach in medical education? That's kind of what you just answered.
Oh yeah, absolutely. I mean, you never want to just be stuck on pattern recognition, but a lot of medicine is pattern recognition. But then you have to also stop and think, okay, this is, the pattern, that this patient's presenting with is most likely consistent with infective endocarditis or glomerulonephritis or whatever topic you're talking about. You need to recognize that, but you also need to step back and think about the differential and, well, what else could it be? You don't want to miss anything that could be potentially life-threatening or get fixated on a diagnosis just because of pattern recognition and miss something. But in general, it's a good starting place.
All right. So if you could give one piece of advice to an aspiring physician, what would it be?
The thing that I say over and over and over to the medical students is differential, differential, differential. Never become a lazy physician, right? So patient comes in with a routine problem and it seems straightforward. This is where you can miss things. So I tell medical students, always think about the differential. So yes, this is probably a viral URI, or this is likely a pneumonia or whatever, but what else could it be, just so you don't get surprised, particularly if you initiate a treatment or management plan for the patient and the patient is not improving. So you need to reevaluate and say, what else could it be? So usually your best time of developing a differential is at your initial visit. So I often in my notes will put, this is likely what's going on, but then list other things just in case I need a refresher when I see the patient back. But differential, you don't want to be surprised.
All right. Thank you so much.
Okay, well, thank you.